Welcome to Faith and Politics, a show dedicated to discussing issues surrounding the intersection of church, state, and politics, and the examination of whether you're allowing your faith to shape your politics or are your politics starting to shape your faith. In other words, what do you do when God and government come face to face? I'm your host, Orlin Johnson. Let me introduce you to our panelists for today. First, we have with us Ms. Joy Mosely, who's the Associate Vice President of Government and Strategic Relations for the Council of Christian Colleges and Universities. We also have with us Dr. Andrew Polk, who's an Associate Professor of History at Middle Tennessee State University and the author of the critically acclaimed book, Faith and Freedom, Propaganda, Presidential Politics, and the Making of an American Religion. We have Mr. Andre Wang, who's with us, who's the General Counsel of the North Pacific Union Conference of the Seventh-day Adventist Church. And we have Dr. Wilmer Leon, who's a nationally syndicated columnist and a regular contributor to national and international television news programs and newspapers. Great to have you guys here with us and looking forward to our conversation for today. You know, there's an interesting issue going on in South Texas in which a South Texas school district was asked to remove 676 books from the library. You know, the superintendent of that school district, which is in the Mission District, received an email that there were 676 books that a group of local pastors believed were, quote unquote, filthy and evil. You know, the email came from a pastor by the name of Luis Cabrera, and he leads a church that's very close to the district, maybe about 30 miles away. And the email was clear that he and the pastors thought that these books were in violation of House Bill 900 that requires vendors to rate their books and materials for appropriateness based on the presence of anything having to do with sexual depictions, any references, and wanted to make sure that was all clear before it came to a library. You know, despite all of this going on, the school district actually was trying to figure out how do we move forward and get information, but make sure we're not in violation of the law. Well, Cabrera and all of these other pastors said they wanted this to come to the school district. They wanted to make sure that they were going to take these books out. They had a lot of public conversations about it. And at the end of the day, the question is who's right and who's wrong. You know, Joy, when you take a look at what goes on in school districts and other places that want to make sure that they're putting things out that's supposed to really be protecting children or protecting young people from inappropriate information, how do we kind of balance that to some degree from a First Amendment rights and making sure we're not doing something that quote unquote is inappropriate?
Right. These questions have been going on for centuries, as we know, in terms of book banning, censorship, things like that. But it's ramped up in the past few years, particularly as it relates to human sexuality. And this is a public school library, so this is not private, but this is also a school library. So a school board does have a lot of authority here. But the reality is, a school library can't have every book out there. And so you choose books and you choose them based on, I would argue that the key thing should be the educational value of the book. And so when you're looking at books that, you're going to have in the library, not only do they need to have an educational value, but it's completely appropriate to ensure that they are age appropriate for the K through 12 school. And you just have to make sure, you mentioned the First Amendment protections. So there's a PICO case, which is sort of the seminal case in this issue, and it says that you can decide that books have certain literary value, certain educational value, but you can't remove a book just based on ideological or political perspectives. That would be censoring speech. So you cannot do that, but like I said earlier, you can't have every book out there. So you do have to make some decisions. You just can't make them based on viewpoint censorship.
Andrew, that viewpoint censorship seems to be almost exactly what we see going on here. And I guess the role of the community as it engages in this activity seems to be a little bit confusing. You can't just show up, I guess, or maybe you can just show up. Or is this just, American democracy at work?
No, I think the problem with a lot of these book bans that are going across the nation, and that's true in my state of Tennessee too, it's happened in a bunch of schools, school districts around my area, is that even though it's often billed as parental rights or the community making sure that children are protected, in almost all these cases, including the case that we're talking about here, it's not a community upswell of concern. It is one or two individuals, right, that have this list, they give them in. And in this case as well, it's incredibly difficult for administrators to figure out how to move through this. The squeaky wheel gets the oil. This is one of those things where one person is coming up saying this is unallowable, right? Children are going to be hurt, but not necessarily of their children in the district, that their children don't go there or they don't have children. So it is a few people policing what children can read across the district. I think that is the central problem of this. If this was community related and a community comes together and tries to figure these things out, I think it would be a different type of issue. But that just is not the case factually throughout the nation.
Leon, it almost looks like this operation doesn't really even have standing to actually make these arguments.
Well, actually, it shouldn't. And I think it's also important to view this in the broader context on an overall attack on education in this country. As the Trump administration wants to talk about doing away with the Department of Education, so it to a great degree comes down to what are we teaching our children? Why are we teaching them what we're teaching them? Or why are we refusing to teach them? I also tie this to, there's an incredible increase in the level of anxiety that they're finding in children in middle school and high school. Well, some of this might be the fact that we're now finding it more difficult to teach our children the things that they need to understand in order to cope with life. My son frames it as a lot of these kids aren't built for the no. And final point, one of the books that they want to ban it's not the Diary of Anne Frank, but there's a revision of the book. And you don't want to teach the kids about the Nazi Holocaust? You don't want to teach the kids about Anne Frank? That's insane.
Andre, I'm wondering, is this one of those things where it just depends on where you are? I mean, this is the state of Texas. Maybe you don't see this in a state, maybe, for example, like New York or California. I mean, how do we allow ourselves to really determine what is the local community, quote unquote, viewpoint? Or should a community viewpoint be allowed to weigh in on something like this?
Right, and I mentioned this in a previous show, but it goes to the famous words of Justice Potter Stewart in a famous case where he says, "You know it when you see it." And I remember as a little kid at a neighborhood bookstore, there was a section in the back that had a curtain, and adults only. And I remember as a little kid going, what's back there? And and actually as I got older, I had an older cousin who actually took me back there, and actually it wasn't a pornography section, but it had books with themes of death and violence and survivorship of horrific historical events, things that had were of a graphic nature. So yeah, appropriately, yeah. I mean, you want to keep those that in that bookstore, you wanted to keep that literature separate, because a lot of the content was not appropriate for a child like me to look at. But look, I mean, I had a teacher in elementary school, Mrs. Brooks, who said regularly, the more you read, the smarter you get. And and what she meant was, when you read, you learn things. You explore different ideas. You develop critical thinking, and so this kind of goes beyond kind of the freedom of expression and kind of learning tolerance and kind of representation of the author. And we really want to develop this whole idea of in education. Learning both sides, learning learning about all perspectives, and developing those critical thinking skills. So, Dr. Polk is right. I mean, the whole idea of just a select one or two or group of people, imputing the values on an enrollment or a group of students is not. That's certainly not the business, and certainly not the role of a small group of people or the government to impute its values on others.
You know, there's also a reason why you have a school board.
Right.
There's a reason why you have educators, people with degrees in education that study and focus these things. And we need to trust the folks that we elect or appoint to manage these things. And this is a public school. So if these pastors or their congregants have a problem, that's why you can put your kid in a private school and you can do then wherever you want with whatever you want. But in the public setting, we have educators for a reason. You get a PhD in education for a reason, and maybe you need to trust them since they study this and they live this, as opposed to your particular concerns about the Diary of Anne Frank.
To build off of that, if there is a true community groundswell, then most school boards are elected officials. So there is a democracy piece to this where they can be voted out. But back to Dr. Polk's point, in most of the cases, it's not a community groundswell. It's one or two individuals. But there is a process. If the community really doesn't like the school board's decision, those members can be voted out, though the school board still has to comply with the law, even while taking the community feedback into account.
You know, Andrew, one of the things that I find interesting is this idea that you have a groundswell or you don't have a groundswell. But it seems as though nonprofit organizations, advocacy groups, and other organizations that sometimes are so far removed from these places that are coming in with an ideological viewpoint that we don't even know if it has anything to do with the books, but their own personal beliefs, their own religious beliefs, and trying to impose it on a particular area of society.
Yeah, that seems to be the prevailing theme of American religion in the past, really since COVID. And I don't think we give enough credit to how COVID changed everything, the way we think, what we worry about, the security, all of that. But a lot of this issue that comes down to whenever the discussion of parental rights comes up, right? This is another one of those, well, that's a nice saying. I'm all for parental rights, but I'm all for parental rights because I know what my kids read. I talk to my kid, like if I'm a parent, they check out a book from the library. I have the parental right to pay attention to my children, to know what they read, and to tell my children, I don't think that book's appropriate. I don't want you reading that. And they go get a different book. It's an entirely different thing for me to say, I will determine that for everyone's child in my district. That's not parental rights because you're taking that away from the other parents. That's what we mediate in these public spaces. We each have our own individual rights, but we don't have the right to do whatever we want to anyone we want, because we live in a society and we have to balance those. So I think that is part of this prevailing issue that's coming up. We love symbols, and people become symbols, and we're fighting for our ideas and rights. And what immediately gets lost in that often from the left and the right is human beings. And at some point, don't we just have common sense?
And I have to let that be the last word, but probably the answer to that, Andrew, is no. We don't all have common sense, but we do realize that this is a parental issue, but we're finding that advocacy groups and legislative groups and every group in the world want you to do what they think is right. And I don't know how long we'll be able to live under those circumstances. You know, there's an interesting case in New York that is the state of New York versus the Department of Health and Human Services. And there is a OBGYN by the name of Dr. Regina Frost. And she's a member of an interesting group. It's called the Christian Medical and Dental Association. And religious health professionals like Dr. Frost, they care for all parties and all types of patients, and they're consistently on the front lines of serving the most vulnerable people in society, people who are underserved, migrants, victims of gang violence, sex trafficking, and a number of other ills of our society. But HHS released a conscience rule that was basically revised, that was enforcing some existing laws and that were allowing religious healthcare professionals to continue their work without having to perform certain procedures. But several states have now come back and have decided, including New York, that they want to change this regulation, and therefore individuals like Dr. Frost and others who do not want to engage in certain activities that violate their conscionable, or what I would call conscionable, objections on certain procedures are now being told if you don't engage in these activities, you could find yourself losing your license. You know, when I start to take a look at a case like this, where on one hand you get this flexibility so that your religious convictions can be, brought to fruition, and then all of a sudden someone decides in a state legislature, we don't like that anymore. We're going to pull the plug and get the whole process going again. Andre, when you look at these type of cases, it seems as though everything is getting personal. The idea of creating some rules and regulations, and I was always taught by great legislatures, whenever you put a rule in place that's only designed to probably go after one person, it's probably a bad rule. And it seems as though we're seeing more and more of that taking place. Andre, what are your thoughts on this? And where are we going from a society probably?
Yeah, so Dr. Frost is an OBGYN, a Christian, and as you mentioned, she's part of an organization that serves vulnerable populations, and the Department of Health and Human Services, a federal agency, is what promulgated the conscience rule that allows doctors, nurses, healthcare practitioners to serve patients without being forced to violate their personal conscience, and so Dr. Frost falls in the middle of this. And really, no doctor, and what I venture to say, no, professional should be put in a position to choose between giving up their faith and abandoning a vital medical mission. And so really, kind of the New York's challenge to the conscience rule, you could potentially pose a threat to health, safety, and put the lives at risk of the people that people like Dr. Frost are serving. And so really, when you kind of look at it from the side of as a matter of conscience, healthcare professionals really shouldn't be forced to be put into this position to perform medical procedures or to practice medicine that would require them to violate their beliefs.
Leon, when you see something along these lines and you start thinking about what are the particulars or what is the reasoning, what does the state gain by trying to move forward in this vein? That's where I'm kind of confused.
Well, I have a problem with the conscience rule overall, because to me, if you have to get and I've said this on the show before, if you have to get a license from the state in order to engage in a particular activity, then you should engage in that activity for everyone in the state. Your conscience should not weigh in to this. Otherwise, the state is allowing segregation. And I don't think that should be supported by the state. The first element of the Hippocratic Oath is do no harm. And you can do harm by what you do, and you can do harm by what you fail to do. And this also takes me back to the death of Dr. Charles Drew, the gentleman who invented the use of the separation of blood plasma. And how did Charles Drew die? He died as a result of a car accident, taken to a North Carolina hospital where they had an unwritten conscience rule where they would not provide service to African Americans. And the man that invented blood plasma died because a white hospital wouldn't give a black man a blood transfusion. So I have a real problem with the conscience rule. If you're a physician, be a physician for everybody, or be a veterinarian.
Andrew, when you hear that, and apparently somebody in New York also has a problem with the conscience rule, that I think where we are as a society, the ideas of what your personal beliefs may be starting to get pushed to the side, and we may find courts really having to delve into issues that maybe they thought they would never have to be involved in.
Yeah, I mean, I think Wilmer and Andre absolutely nailed the two, not necessarily competing, but the two issues that are rubbing together in this type of a case. One is simply the fact that we have some states saying in the medical field, everyone has to do this no matter what you feel about it, right? This is what's happening. Like, no matter what your conscience is, no matter how you personally feel, everyone does this. You have other states, Texas, Tennessee, where I am, saying, no one can do this, right? If we have an issue with it, a personal conscience that says this shouldn't be done, well, then no one can do it, right? That in itself is a difficult issue, right? Because it's not about the actual experts themselves. It's not about the boards. It's not about the community. It is all or nothing based on our ideas and symbols. But the other issue that Wilmer laid out here incredibly well is we're also battling when we keep coming with these court cases, including as we talk about on this program, right? It increasingly becomes a question of how much do we have a religious right to discriminate? Does my religious idea say that I don't like this and therefore I won't give it? Now, there is a difference. It's not apples to apples for can I make a cake for a gay wedding and will I give this procedure, right? And even the procedure becomes, is this something that's absolutely medical necessary or is this an elective procedure, right? Those are not treated the same under the American Medical Association, right? So there's a lot of issues that are backed up in this. I tend to agree with Wilmer as kind of a baseline of this. I think there are some parts, especially in the Hippocratic Oath, you serve and you help and you heal. And I'm not sure the religious standpoint of I won't do that until you get to the point of elective procedures. And then I think that's a fundamentally different thing. So I don't have a full answer on this one, but I sure wish we would all admit that there's a lot of messy, complicated issues involved. And man, one size fits all is hard. And that's what we seem to be doing.
You know, Joy, when you start talking about healthcare issues and issues that sometimes are even more unique from a gender perspective, it almost seems a little bit ironic that you have individuals who have no personal, I guess what I would call understanding of how something may be, but now the idea of what's private, what's not private, you know, what do you get to do? What do you don't get to do? What do you allow? What do you don't allow? I mean, it's getting so messy. And it seems like everybody thinks they're an expert. That's the part that's really troubling.
Right. I mean, there's, many doctors don't have expertise in every area. So you don't necessarily want someone performing a particular surgery when it's not their area of expertise. You actually want an expert doing that. But you also want to make sure that you do allow the most solid and well-equipped doctors to be able to perform these surgeries, even, and people who have sincerely held religious beliefs should not be excluded from that. And so I think we have to make a distinction between serving everyone, which doctors do, versus unwilling to do certain procedures that violate their conscience or religious beliefs. So they're not neglecting to serve an entire class of people. They're saying this particular surgery, maybe performing an abortion or something like that, violates their religious beliefs, yet they're willing to see women, just so I do think that in this case, we do need to be really attuned to the religious protections and ensure that we are allowing doctors who, we need great surgeons, we need great doctors serving everyone, and to exclude people because they're not willing to perform certain surgeries that violate their religious beliefs, I think would be a big mistake.
Wilma, I got to ask the question, though. I like the idea of you being in a position where if you get a license, you have to do certain things. But as a patient, I'm not sure I'm that happy about somebody performing a procedure on me. And I'll put it this way, if their heart really isn't in it. If you're reluctantly engaging in some activity, and I know the Hippocratic Oath says that, quote unquote, first do no harm. As a patient, I don't know if I'm that comfortable with that concept. So I'm wondering if maybe the conscience rule maybe is also something that could be in the best interest of the patient.
Well, that's a great point. And I'm glad you brought that up, because I think in that you also have to separate not only, as Andrew mentioned, elective versus non-elective, but emergency versus non-emergency. So and I've had both knee surgery and shoulder surgery. And so to Joy's point, I didn't go to my knee surgeon for my shoulder surgery, and I didn't go to my shoulder surgeon for my knee surgery. But to your point, if as a patient you say to me, this is a procedure you need done, and because of my religious beliefs, I would prefer not to do the surgery, then as a patient, if I'm smart, I'm gonna say, you know what, doc? Thanks for that honesty. I'm gonna go down the hall. But and it's the same thing about baking a cake. If you go to a bakery and they say, you know what? Because you're gay, I don't want to make a cake for this. You never want someone handling your food that you don't trust. And you don't want a surgeon putting their hands in your body that you don't trust. But in the case of an emergency situation, when we don't have the opportunity to have that conversation and they wheel me into your emergency room, you better sharpen them knives and get to getting, because the conscience rule, I don't believe, has any place in medicine.
Well, I tell you, when I think about the conscience rule and what we're looking at, the real issues that come into play is whether or not you're now conflicting your religious beliefs with your required activities based on the license that you have. And I think that's when it starts to get a little bit murky. But the idea of somebody performing surgery, if their heart isn't in it, I don't want to have anything to do with it. But if it's an emergency and you have the ability, chances are you're probably going to have to step in from a societal standpoint. Hey, Andrew, tell me something I don't know.
Well, I just learned this from my 10-year-old this morning, and I bet you don't know it. Did you know that Americans daily eat 100 acres of pizza? I don't know why they had to convert it to acres, but it's still true.
Wow, did not know that. Wilmer, tell me something I don't know.
Well, I think it's important for people to know that as this ongoing debate about providing fire relief to those in California, and it's Republicans that are championing a lot of that, the John Birch Society started in Orange County, California. There are a lot of Republicans in California that had their houses burned down, and there are going to be a lot of unhappy Californians if this foolishness continues.
Wow. Andre, tell me something I don't know.
Do you know that the United States actually celebrates Banned Books Week? Started in 1982. It goes from September 27 to October 3.
I did not know that.
Except
Joy.
in Texas.
Joy, tell me something I don't know, Joy.
Did you know that the shortest war in history was in 1896 and lasted just 45 minutes?
No, I did not know that either. Thanks so much for being here with you. Great conversation. Looking forward to doing this again soon. And thank you for being here with us. Hope you enjoyed our show. Just remember, if it's about God and government, it's faith and politics. See you next time.